help oversee the clinic programs at the agency, which are both mental health clinic programs and drug and alcohol clinic programs. I predominantly focus on the drug and alcohol clinic programs, and they are outpatient, which basically means that the individuals that come to our services come for their appointments and then they go home after the appointments. It's not a residential placement, it's not a hospital setting. There are a lot of other services like that in the addiction world, but that's not what we provide here. So my frame of reference in terms of the treatment for individuals who are struggling with different substance use disorders is on an outpatient basis. I've been in the field for 10 years, and my whole working career and even part of my internship has been through clinical experiences, both with mental health and individuals with substance use disorders. And I'm really passionate about working with that population, and I love to share my experiences and what I've learned along the way. Outpatient treatment also, we provide both individual services and groups. The groups that we provide for individuals struggling with substance use disorders cover a range of topics. We have relapse prevention groups, we have groups that are straight education, where we're talking about the different substances and the impact on your body and your health. It could even talk about the legal consequences that come with the use of drugs and alcohol. We also have different topic groups that help individuals that are in treatment maybe connect more with the other individuals that they're in group with. We have, at our Bayshore location, we have a professionals group, which is a really unique topic, and it's been a really interesting group that we run. We also have women's group, men's group, adolescent groups. We have co-occurring disorder groups for somebody who might have both an addiction or a substance use disorder and a mental health disorder. So we have lots of different kinds of groups that the individuals that come to our program can take advantage of and can benefit from. In the outpatient program, so we cover a large variety of Suffolk County at Family Service Lead. We have the drug and alcohol programs at Bayshore, Riverhead, and also Mastic. And for the most part, the types of individuals that come to our program, it ranges from male to female ratio. We pretty much, it's more male than female. The approximate percentage is usually about 70% male to about 30% female. And the age range that we most commonly see is somewhere between the age of 25 and mid to late 30s. That's the most prevalent age range that we see in our treatment programs. In terms of diagnoses, I would say that alcohol is still a very prevalent substance use disorder that individuals come to treatment for, but of course there's been a lot of talk of the opiate use disorder on Long Island, and we definitely see that in the treatment programs. We've seen a rise in the amount of individuals that come into the program who are struggling with anything from pain medication that they were prescribed to individuals who have progressed and have started to use heroin. So we see a lot of that in the treatment programs as well. We treat every substance, though, under the sun. So we have other individuals that come in that are struggling with marijuana. They might be struggling with other substances that are prescribed or not prescribed, illicit drugs like cocaine. So we see pretty much everything in the treatment programs. To provide a little bit more information about the opiate problem on Long Island, being a treatment provider in the community, I attend a lot of meetings where I talk to other treatment providers. I go to county meetings, and I learn a little bit about the prevalence of the problem. And one of the recent statistics that I thought was really interesting that came up in a county meeting is the number of individuals who have been saved by Narcan. I don't know if you're familiar with what Narcan is. Narcan is a nasal spray that can be given to an individual who is overdosing on opiates, and anybody can get trained on administering Narcan. The county actually does a lot of trainings on it in the community. Family members, significant others, a lot of, most EMTs, police officers, hospitals, social workers like myself, we can all get trained on how to administer Narcan. So one of the things that came up at a county meeting is the rise of how many people have been saved from Narcan, which is a wonderful thing that the lives are being saved. But the other issue is that it just shows the prevalence of the problem. So I know back in 2012 there was about 300 something reported, and in 2017 it was almost 750 for the year. So it really shows the prevalence of the problem on Long Island. So there are a lot of different facilities that provide Narcan trainings, but one of the best resources is to go on the Suffolk County government website. The Department of Health and Mental Hygiene has a lot of information about Narcan, and the facts that I just shared with you on the website. They're a really good resource, not only for that information, but they also have a lot of information for family members or significant others that can help you figure out how to get that person help, and maybe even how to identify that something is going on with them. There's a lot of different resources that are out there, and I would say that there are two that are most significant that can be really helpful to families that might need education, might need help getting treatment for somebody that a loved one or a family member. One is OASIS, and that is the Office of Alcoholism and Substance Abuse Services, and that's a New York State organization that regulates all of the drug and alcohol treatment providers. And not only do they regulate the treatment providers, they also provide a wealth of information. They have a Hope line that is available 24/7. They have guides on their website of where to find treatment, and they have educational materials as well. The other resource that could be really helpful for a family member or for a loved one of somebody struggling with an addiction is SAMHSA, and that is SAMHSA is Substance Abuse and Mental Health Service Administration, and that's another really great place where individuals who are a family member or a loved one of somebody struggling with an addiction can get information. They can get education. They can look at documentations that would help them identify if somebody's struggling with an addiction. Addiction is definitely a disease of secrecy and denial, so it could be very hard sometimes to break through that if you are trying to identify addiction in a loved one. You're trying to help somebody with an addiction, so it's really important that if you are a family member or a loved one who's trying to help that person, that you educate yourself. I think addiction is a family disease. I think that everybody's involved in trying to get that person help needs to have some sort of support in order to battle it and be prepared. And I also think that in terms of prevention, getting treatment early is the best possible thing. I think a lot of families or individuals try to postpone, thinking that it might go away, and the family might want it to go away. It's not a happy thing for a family to go through, and unfortunately sometimes that leads to the family losing that loved one. And those are those stories that we all know, that we all have family members and friends who have gone through this. So I really think that one of the most important things is that families take quick action, and the individuals take quick action and get help as soon as possible when this is identified. I do think any sort of information or promotion of this sort of information is helpful. I think it helps individuals and families realize that they're not alone, and I think that it's important to that we all share the knowledge of the things we know about the resources that are out there. So any sort of a resource to families, I think, is a wonderful thing. So I hope that this book and this project does help move that along and share some of this information. For any individual that's looking to seek treatment, a couple things usually happen when an individual comes into one of our programs. They have an intake assessment, and they start to work with an individual counselor. And, in that time, they have to build that rapport and that relationship with that individual counselor so that they're able to get the help that they need. Some of the things that we try to do is we try to meet the person where they're at. We try to address the whole person, not just the addiction. And pulling family in, if the individual is open to that, is also a very helpful thing that we can do in treatment. We have a lot of different individuals that come and utilize our program. We have individuals who on their own come in and recognize that they have an addiction or they're struggling. We have individuals like in our professionals track that their career, their employer mandates them to be in treatment because it's impacted their performance at work. We have individuals who have had legal consequences of drug and alcohol. We treat a lot of individuals who have gotten DWIs or DUIs. We have individuals on probation and parole. We have individuals that have CPS involvement. So we treat a very large range of individuals in treatment. And I talked a little bit earlier about the groups, and many of our groups, some of them and most of them are going to be mixed populations, which can be very interesting for somebody coming in who hasn't had that level of consequences yet. It could be very therapeutic for them to hear about what could happen if they don't start to make changes. So we like the groups for that reason. We think the group treatment is a very big part of drug and alcohol treatment, and it really helps individuals move along. The mutual clients or the individuals that are in groups can really relate to the individual in treatment on a different level than our counselors can. The treatment is person-centered, and it has to be by client choice. Any individual who has who is struggling with a drug or alcohol disorder needs to be willing themselves to get the help. And that's why, I said earlier, it's a family disease. It's something that the family needs to be involved in together, because many times we'll get calls from family members and they are distraught and they don't know where to go and what to do. And, if the individual isn't willing to get the help and take the resources that the family is finding for them, that can be very wearing and difficult on the family. So, many of the outpatient substance use providers also treat the family members or loved ones of those struggling with an addiction, because that could be just as challenging to cope with. So I would say that can be a very frustrating part of the experience for family members.
Mm-hmm. So there's one lady that I talked to, she had a son who passed away from overdosing on heroin, mm-hmm. and she said that while he was still struggling, she went to parent groups and stuff. Do you mm-hmm. offer stuff like that?
Yes, at Family Service League we do have support groups that are no charge to family members who have an individual who is struggling with an addiction, and we also have support groups for family members who have lost a loved one. We have them running at our Bayshore and Massac locations, and there's no charge for them, and the information is on our website, and that's a very special program that was actually started by the mother who lost her son to addiction as well. So it's called ADAM, Addiction Direction and Management. That information's on our website, and it's free to family members that want to attend.